In this lecture, I am going to talk about the fracture of the mandible. And in the previous lecture, we discussed the middle third fracture. And this is the lower third fracture regarding or include the fractures of the mandible. Second slide, going to talk slightly introduction about the subject, fracture of the mandible. And the fracture generally is defined as a break in the continuity of the bone, which appear either as a result of violence or unhealthy or unable to withstand normal stresses. Fracture of the mandible are commonly seen due to the prominence of that bone, prominence of the mandible, and the blow on the mandible are transmitted directly to the base of the skull through the temporomandibular articulation. So it is a dangerous fracture which might lead to invading the middle cranial fossa and to do a head injury. The third point, the impact force that required to produce mandibular fractures are higher than that of the maxilla, because the mandible is a strong bone, one piece, strong bone, so need a large force. When the force are applied to the bone, the buccal cortex of the bone at the side of the application of the force undergo compression. And the other lingual cortex, as in this image, this is the buccal going to direct compression, and the lingual going to be compressed. Undergo tension, the buccal cortex is going to be compressed, and the lingual one is under tension. If the force is greater than the compressive and the strength forces, at that time fracture of bone occur. It means when the force greater than the compression and the tension force, fracture of the bone occur. The teeth are important in determining whether a fracture occur, because when there is a fracture, there is disturbances in the occlusion, and even the teeth might be fractured. The long canine teeth or tooth and the partially erupted or unerupted wisdom tooth both present line of relative weakness, presence of the third molar and long canine regarding as an weak area which assists in the happiness of the fracture. The alveolar resorption that follow tooth loss also weaken the mandible, and the fracture of the edentulous body often result from much smaller impact. If you look for this image, this is severe resorption of the bone weak. So smaller force, impact force might be lead to the fracture of the mandible. Regarding the surgical anatomy of the bone, the mandibular bone is a free bone forming the lower border of the face. Tubular long bone bend into a V shape or U shape. Shape of the mandible as a V or U shape, mostly U shape. Prominent bone, strongest bone, and heaviest bone on the facial skeleton differ from the maxilla. It is a membranous type of bone and articulate with the temporal bone through the condyle. During the articulation in the TM joint, articulated with the temporal bone, and the temporal bone is near the or form part of the middle cranial fossa. Area of weakness of the mandible. The area which is regarded as a weak in the mandible is first the junction of the alveolar bone and the basal bone. as you know, the alveolar bone, the bone forming the teeth or holding the teeth called alveolar bone, and the lower part of the bone called basal bone. Symphysial region, prominent region, symphysial weak area, and parasymphysial parallel to the symphysial region, also regarded as a weak area. The angle between the body and the ramus is a weak area. Impacted third molar assisting the fracture. Excessive long root of the canine, as I mentioned before. And the neck of the condyle is a weak area. So many fracture or forces directed to the mandible lead to the fracture of the neck to prevent the introduction of the or introducing of the condyle and the middle cranial fossa inside the brain. So it is regarded as a protective measures. Mandibular fracture is more common than the middle third fracture. It could be observed either alone or combination with other facial fracture, as in the middle third fracture. When we say that middle third fracture might be associated with other fractures, especially the vertebrae spinal fracture. Minor mandibular fracture may be associated with head injury owing to the craniomandibular articulation. Sometimes even a minor fracture or minor trauma to the mandible may be associated with head injury due to the direct relation between the bone, the mandibular bone, and the cranial bone. Mandibular fracture may compromise the patency of the airway, in particular with the loss of consciousness. When fracture of the mandible occurs and there is a displacement of the bone posteriorly, or especially in the parasymphysial region or symphysial region, there is no support to the tongue, so the tongue might be pushed backward, leading to compromising the patency of the airway, especially for unconscious patient. So when you have such a fracture, you have to do something to support the bone, or to push the bone, or to reduce the bone to open the patency of the airway. Mandible is more sensitive to the lateral impact than the frontal force. This is by experimental study. They find that mandible is more sensitive when the lateral force is applied to the mandible than from the front area. Fracture of the condyle regarded as a safety mechanism to the patient to prevent the intrusion of the condyle and the middle cranial fossa. So we have a neck fracture. It is better than to introduce the condyle and the middle cranial fossa. Depending on the type of the injury and the direction of the force and the force of the trauma, fracture of the mandible commonly occur in several locations. Several location and many classification for the mandible might be occur in the body, might be occur in the symphysial region or the angle or the condyle, and very rarely for the coronoid process. Classification of mandibular fracture. Mandibular fracture could be classified according to the type of the fracture. So mandibular fracture can be classified into, according to the type, simple or closed fracture, a type of a single fracture that does not have communication with the external environment. There is no tissue laceration, there is no laceration of the tissue by the bone, so they call it simple one, without communication with the external environment or the oral cavity, or external environment, which might lead to the contamination and aggravation of the healing of the fracture. Other type called compound or opened. This type of fracture that extended into the external environment through the skin or mucosa. externally or internally to the oral cavity or the external environment due to tearing of the skin or oral mucosa or periodontal membrane. This is called compound fracture. Comminuted fracture, from its name, when the bone is fragmented into pieces like this. This is a comminuted fracture. This usually requires a considerable more energy than do simple force. When there is a large force, lead to such type of the fracture, especially the missile injuries. The other type of green type of fracture called the green stick, يعني الغصن الأخضر, when only one cortex of the bone is broken and the other cortex being bented only. It is found exclusively in the children because of they have a resilient bone. As in this image, you have to see there is a fracture of one cortex and the other is bended, called the green stick fracture. And this image also seen, this is a fracture of the cortex, but there is no fracture in the lingual. This is called green stick fracture, and this is mostly happen in the children. For the comminuted fracture, as we said, when there is a large forces to impact on the bone, especially for the missile injuries, we might be shattering of the bone to small pieces or large pieces with laceration of the tissue. The fracture bone is left in multiple segments, as in gunshot wound, penetrating object, and other high impact injuries to the jaw frequently result in comminuted fracture as seen in this image. Multiple segment with laceration of the tissue and sometimes loss of the tissue. Soft or hard tissue might be lost or avulsed. Mandibular fracture might be caused by the pre-existing pathological condition. When there is a pathological condition in the bone of the mandible, it assists in the happiness of the fracture, like osteomyelitis, as in this image, and this is pathological fracture, or neoplasia, tumors, or generalized skull disease that lead to fracture from minimal trauma. This is an impaction with cystic lesion, weakness of the bone, read this cracking. Complicated or complex fracture associated with the damage of important vital structure, complicating the treatment, as well as the prognosis, including severely atrophied mandible. When there is a severe atrophied mandible with complex fracture, it is difficult to treat such a condition. It might be need external fixation or need grafting, so it is difficult case. Single fracture, only one fracture line in the same bone, they call it single fracture. When there is only one fracture line in the same bone, one fracture line in the same bone. Multiple, two or more line of a fracture on the same bone that do not communicate. You might find more than one fracture at the same bone at the same time. So you have, when examining the patient and examining the patient clinically or examining the radiograph of the patient, you have to seek for more than one fracture line. Fracture of the mandible can be classified according to the anatomical location, anatomical site. So we have dentoalveolar, regarding the dental alveolar bone, condyle, when there is a fracture of the condyle, chronoid fracture, ramus fracture, angle fracture, body, it means including the molar and the premolar area, symphysial or parasymphysial region. And there is different studies regarding the frequency of the fracture of this area, and this different study, different area, different region, different environment, so we have different number. But in general, fracture of the angle of the mandible and the condyle is the most type of fracture, as seen in this image. About 25% for the angle and 30% or 29% for the condyle of the mandible. This estimation is also important for when you are examining a radiograph, you are seeking for this site, for the common site of fracture. So a different site of mandibular fracture with a ratio of occurrence. The site of the highest risk of fracture is the condyle, followed by the angle and the symphysial region, while the chronoid and the ramus are the least susceptible fracture. But you have to seek for this type of fracture, even they are rare, but it might be happen. Mandibular fracture can be also classified according to their tendency to displace as a result of the pull of the attached muscle. As we know, in the mandible there is a lot of muscle attached to the mandible in the lingual or buccal surface or anterior surface. So the fracture pieces might be displaced during the fracture, and this displacement lead to classification or affect the classification. So they can classify mandibular fracture for favorable or unfavorable fractures. When the muscle tend to build the fragment together, minimize the fracture, as in this is a fracture, but the displacement lead to the favorable position. But there is when there is a displacement of the posterior teeth of the posterior fragment, they called unfavorable fracture, lead to the displacement. And this displacement might be classified also vertically or horizontally, because the bone might be extended or displaced upward or downward, or lingually or buccally, either vertically or horizontally, either vertical, horizontal, favorable or unfavorable, depending on the direction of the displacement. Although this principle can be applied to any fracture of the mandible, where there are a muscle attachment, it is mostly common used with the angle fracture. Angle fracture because of the presence of the masseter muscle and the medial pterygoid muscle on the medial surface, and the anterior region there is a hyoid muscle attached to the symphysial region and suprahyoid bone. All these muscles lead to vertical or horizontal fracture. If you look for this image, this is the medial pterygoid and the lateral pterygoid muscle, which lead to displacement of the fracture. This is vertically favorable, and this horizontally unfavorable. And if you look for this image, so you can assist for understanding of such type of fracture. The same for this image, vertical and horizontal type of fracture. For the muscle involved in the pulling of the bone, as I told in the previous slide, the muscle which affect on displacement of the fracture of the mandible, there is a lot of the muscle, as seen in the image, is the lateral pterygoid muscle attached to the condyle on the medial surface of the condyle. Temporalis muscle attached to the coronoid process, affect the displacement. Medial pterygoid muscle, masseter muscle, these muscles. Genioglossus attached to the genial tubercle on the lingual surface of the anterior region. And geniohyoid from the genial tubercle to the hyoid bone, and mylohyoid bone and digastric. So we have 1, 2, 3, 4, 5, 6, 7, 8. 8 muscle might affect or lead to the displacement in a favorable or unfavorable position and direction, in horizontal or vertical direction. So you have to understand such effect. This is an image for the parasymphysial fracture, where there is parasymphysial on the two sides bilateral. There is a displacement of the bone posteriorly. So the supporting bone of the tongue, there is no supporting for the tongue. So the tongue going to be displaced posteriorly, affecting the patency of the airway. This is called pocket handle fracture, especially when occur in edentulous area, edentulous mandible, as in this, when there is a displacement of fracture on two sides. Muscle effect might displace the anterior segment posteriorly with the tongue, called pocket handle. بوكيت هاندل يعني مثل السطلة، تشوفون هذا الهاندل مالت السطل، يعني كأنما الهاندل مالت السطلة نسميها بوكيت هاندل فراكتشر، مو اسم واحد وإنما تشبيها بهذا. In bilateral fracture of the anterior region, parasymphysial fracture or incomminuted fracture. Two types, parasymphysial and comminuted fracture. In the mental area, pull action of the muscle attached to the genial tubercle tend to pull backward the anterior segment, and this results in backward displacement of the tongue, which is deprived of anterior skeletal support. يعني ما يصبح عنده support، يصبح طايف الtongue, which lead to respiratory embarrassment. This is a very important spot, and you have to concentrate on this complication. And this is the image which discusses when there is unsupport for the mandible. All the tongue go backwards, so the compromising the airway of the patient. According to the classification of the mandibular fracture, also mandibular fracture could be classified to direct and indirect fractures. What mean by this term? When the force is applied to the mandible, the point of application to the bone is causing a compression of the bone, causing direct fracture. The other resultant factors traveling along the bone and applied tensile strength on the point of the intersected by this factor, causing indirect fracture. If you look for this image, if you have a trauma on this area, if you imagine this is the mandible, this area direct fracture occurring due to the compression. The other side going to be tensile force applied of tension on this area. This tension area might be transmitted to the other distant area, leading to the fracture called indirect fracture. So when you have a direct fracture is seen at the site of the primary impact, one must examine the corresponding indirect fracture site and rule out of the indirect fracture. So تشوفون احنا دائما روتينلي لما اكو عندنا direct fracture دائما when we examine the patient clinically or on a radiographic examination we are searching for indirect fracture. When you have a fracture in this area on the mandible, on the body of the mandible, you might be expect to have subcondylar fracture or a fracture in the angle of the mandible, in the contralateral or contralateral area of the mandible. This is a routine work for those who are working or have a clinical training in the maxillofacial surgery or trauma. And this is an example for common combination of direct and indirect fracture are where there is a symphysial direct fracture, منطقة symphysis region, combined with bilateral subcondylar fracture are the indirect, هنا direct, هنا indirect, subcondylar fracture, also called baradi ground fracture or guardsman fracture. البارادي جراوند يعني ساحة العرض بالعسكريين يوقعون هم يتدربون أو هو دايخ ويوقع يصير عندهم أم يسموه الجارزمان الحراس. هذول يصير فراكشر عندهم دائما منطقة السيمفيزيال أو باراسيمفيزيال ويصير عندهم indirect fracture منطقة الكوندايل أو منطقة الأنجل of the mandible. The other example is parasymphysial. هنا symphysial parasymphysial beside the symphysial area. When we have a direct trauma or direct fracture with parasymphysial combined with contralateral يعني the other side of the fracture subcondylar and angle fracture of the mandible يعني إذا عندنا بهذا المكان fracture you have to expect there's a fracture in the subcondylar region in the contralateral side or the angle of the mandible. Body direct fracture when it is a body fracture of the mandible combined with contralateral fracture in the subcondylar. The other slide is the clinical feature of mandibular fracture in general. The main clinical feature of mandibular fracture includes pain, especially on talking and swallowing, leading to drooling of saliva. عندهم يصير ألم طبعا لما يتكلمون أو يريد يبلعون يصير عندهم لعاب يطلع من حلقهم drooling of saliva due to uncontrolling of the muscular work due to edema or due to pain. Swelling due to edema and hematoma causing facial asymmetry. تشوف المريض عنده facial asymmetry due to edema or hematoma. The teeth near the fracture site may become loosed, displaced or avulsed with laceration of the tissue. يعني إذا تباعون على حلق المريض المكانات اللي بيها fracture أحيانا تلقون التيث loosed تتحرك or displaced or avulsed out of the jaw with laceration of the gingiva, bleeding from the fracture site. تتباعون أيضا تشوفون bleeding بالمكان. This is a clinical feature of the fracture. Trismus and difficulty in moving the jaw, trismus of the muscle leading to difficulty of the or difficulty in the opening of the jaw or movement of the jaw or due to displacement of the fracture by the muscle, as I told before, lead to this limitation. Bone tenderness over the fracture site. This is a normal mechanism. Any fracture in the body, there is a tenderness in the area of the fracture. Mobility of the fracture site. إذا تيجي على هذا المكان تشوف تخلي إيدك على الإكلوجن وتحرك الماندبل تشوف fracture side moved. So movement of mobility of the fracture segment. The other clinical sign you might find in mandibular fracture called step deformity. Palpable at the site of fracture due to displacement of the fracture. If you look for this image, this is a displacement of the fracture. If you put your finger in this area, you find this stepping. نقول بالعراقي قسة مثل القسة يعني. This is called stepping. This stepping is a sign of fracture. Numbness of the lower lip due to injury of the inferior alveolar nerve on the body in the bony canal during the displacement of the canal. During the fracture, you might do a damage for the inferior dental nerve, as in this image. if there is a large displacement, might be lead to the tearing or trauma to the nerve, leading to the numbness of the lower lip and the area supplied by that nerve. The other sign might be have is altered occlusion due to the displacement of the fracture. If you look for this patient, you see the discrepancy of the occlusion. There is a normal occlusion, but there is an open bite in this area. That means there is a displacement. This is a sign of fracture. The other sign, which is very important in mandibular fracture, is called pathognomonic. يعني علامة تشير إلى أن هنالك mandibular fracture يسموها sublingual hematoma. يعني الهيماتوما اللي موجودة على lingual surface of the mandible, sublingual hematoma below the tongue, which is regarded as a pathognomonic sign of mandibular fracture, as in this image. This is a sublingual hematoma, is a pathognomonic sign of mandibular fracture. In some cases of bilateral subcondylar fracture, and we have two subcondylar fracture with displacement and shortening of the ramus, when there is a trauma to the subcondyle with the fracture, lead to the shortening of the ramus due to the displacement of the mandible upwards. This will lead to premature contact between the posterior teeth and open bite. So you have open bite anteriorly and the premature contact of the posterior teeth, which is lead to the difficulty in the movement of the mandible and the swallowing and talking. Bilateral parasymphysial fracture may be the readily displaced posteriorly under the influence of the genioglossus or geniohyoid muscle. And I told you about this paragraph before when I discussing the fracture of the anterior region of the mandible, and there is a loss of the bony support for the mandible, so the tongue will be displaced backward, threatening the airway of the patient, especially when the patient is unconscious. In some cases of condylar fracture, bleeding from the ear, you find extraoral sign, which is bleeding from the ear. This may be result from the laceration of the tissue from external auditory meatus caused by violent movement of the condyle against the skin on this region. This is one cause. The other cause, it is important to distinguish bleeding originated from external auditory canal from more serious middle ear hemorrhage. Fracture might be from the middle ear hemorrhage, which significates a fracture of the vitreous part of the temporal bone. It means there is a fracture in the base of the skull and the middle cranial fossa, and maybe maybe supplied or accompanied by cerebrospinal fluid leakage. So when you have such a bleeding, you have to be sure this is from the skin or external auditory meatus, or due to the damage of the base of the skull due to the fracture of the vitreous temporal bone. In all cases of suspected condylar fracture, the ear should be examined carefully with an otoscope. منطقة الأذن should be examined by the otoscope. If you are going to examine it, you might need referring or for ENT doctor for the careful evaluation of the ear. Radiographic examination should be supplement the clinical examination. If we talking about the clinical sign, mostly we need a radiographic evaluation for the patient. So we have sent the patient to a number of views to have a good idea about the type of fracture and the displacement of the fracture and the location of the fracture. So the clinical diagnosis of the fracture is essential. but radiographic examination is very important to confirm the diagnosis of the fracture, because it is always you have to depend on the radiographic sign to see if there is a displacement or the type of the fracture, if it's simple or computed or there's a loss of tissue. So it is important for evaluation of the patient. The principle of trauma radiology، دائما لما نريد ناخذ أشعة لجماعة الفراكشر you have to obtain two views, one perpendicular to the others. Not only one, you have to order two X-ray, one perpendicular to the other, like occlusal with the periapical, each taking at right angle to each other in order to assess the degree of the displacement, نشوف ايش قد اكو displacement and the angulation of the fragment. The main views for the assessment of mandibular fracture are panoramic radiograph, OBG, represent the best single overall view of the mandible and the gold standard for mandibular fracture screening, general evaluation of the fracture by one radiograph from the condyle to the condyle. A combination with BA, posterior-anterior view of the mandible, and the OBG is usually complete the viewing of the mandible and obviate the need for further radiographic examination. يعني ما تحتاج أكثر من تأخذ BA وتأخذ OBG يكفيك، تحتاج other you have not need to expose the patient to overall the radiation dose. If the OBG is not available, BA mandible with lateral oblique of the mandible, lateral oblique mandible or lateral oblique ramus can be taken. Intraoral radiograph periapical are required to demonstrate periapical or occlusal if it is available to demonstrate the relationship of the teeth to the line of the fracture. لأن قلنا أحيانا الفراكشر لاين يكون قريب على التيث واحنا نقرر أحيانا هذا التوث يبقى أو should be extracted because it might affect the healing or reduction of the fracture, and to see if there is any damage to the teeth themselves. If there is a fracture in the side of the tooth, there is a shattering of the teeth, so you have to need more detailed X-ray by taking periapical radio. If you look for this radiograph, this is a 3D CT, 3D 3 dimension. شوفك طول وعرض and the depth. This is occlusal. This is a displacement of fracture in the symphysial region. This is BA mandible, show the angle fracture. And this is the lateral oblique for the body or the ramus. And this is BA, so submandibular fracture. And this is an OBG radiograph, general scan, gold standard for the evaluation of the fracture from the condyle to the condyle. The other view called Towns view and reverse town or reverse town view. It's an anteroposterior view. This is especially for the evaluation of condylar fracture. It is an ideal view to showing the lateral or medial condylar displacement. إذا تبعون هنا هذا الكوندايل إذا نريد نشوف lateral or medial displacement of the, you have to order such a view. Also a view number 6 is occlusal view, as in this image. This is an symphysial fracture and this is a displacement of the if the plain radiograph not enough to evaluate and you have the facility to have a CT scan or cone-beam CT scan, you might use such advanced views for evaluation of the fracture. So CT scan is not normally undertaken for isolated fracture. يعني CT scan احنا ما نستخدمها دائما للsimple fracture unless there is a complicating and significant communication for difficult cases. And CT scan is also useful in the assessment of the displacement of convoluted fracture of the condylar region because of the difficulty in the anatomy of this area. So you have to need CT scan in coronal, especially coronal view. And also it is important to see undisplaced vertical fracture of the condylar head. Sometimes there is a fracture in the condyle, and this is in a vertical direction. It is difficult to see in the plane type of radiograph. They take CT scan or cone beam CT scan in coronal and axial direction to see if there is a fracture on the area. Treatment of mandibular fracture. The aims of the treatment in general is primarily to restore the function في سبيل يرجع المريض إلى وضعه الطبيعي to restore the function and to restore both the occlusion and pain free. لما يصير reduction يقلل الألم وعندنا يقلل the bleeding and normal movement of both TM joint. For these goals to reach a precise anatomical reduction is not essential in every case. يعني إذا واحد يسوي reduction ويرجع الماندبل مو شرط إنه يرجع الأكلوجين إلى الطبيعي كلش، مو مهم. إحنا يصير adaptation أحيانا بالمصل ويرجع النورمال occlusion إلى الوضع الطبيعي. Factor affecting the treatment of the mandible. What are the factors affecting the treatment of the mandible اللي يأثر على قرارك أنت for the treatment of mandibular fractures؟ is the fracture pattern. قلنا الفراكتشر أشكال، ممكن يكون simple ممكن يكون comminuted, displaced or undisplaced. The skill of the operator، خبرتك أنت والtraining مالتك. The resources available، يمكن المواد اللي تساعدك على العلاج. The general medical condition of the patient tolerate such an operations or such a treatment. The presence of other injuries with the mandibular fracture, the degree and the local of contamination and infection. هل هذا الفراكتشر اللي وصلك contaminated or directly or with infection؟ كل هاي العوامل تأثر على type of the treatment of the mandibular fracture and any associated soft injury or loss of the soft tissue which might affect your treatment.